we're trying to treat cancer, the goal is to do something that's toxic to the cancer cells, that's non-toxic to the human cells. And current chemotherapy treatments aren't so effective at doing that. It leaves people with nerve disorders and sick and tired and in the hospital and so forth. And when it comes to cannabinoids, even very, very high doses of cannabis is non-toxic to people, to human cells, to healthy human cells. So it's, I mean, there's no lethal overdose of marijuana. You know, very high amounts of this medicine usually put someone to sleep. Sometimes we see paradoxical effects where if someone is exposed to an extremely high dosage, they'll actually start having some of the symptoms that marijuana usually treats, like nausea and vomiting and pain and dysphoria and things like that. And again, that's because this is a homeostatic regulatory system. So when you push it too far in one direction, it crosses the line and goes the other way. Let's go to the next slide. So cannabinoids can enhance the effectiveness of standard cancer treatments. This has also been studied. Standard therapy, radiation, chemotherapy, whatever it is, with or without cannabinoids, the people with do better. Not just because they're able to tolerate their therapy more, which they are, but also because of these anti-cancer effects. The other thing is that cannabinoids possess synergistic anti-cancer properties. So when we look at a botanical medicine like marijuana, there's 60 or more different cannabinoids in that plant. We hear about THC the most, but actually some of these other cannabinoids are incredibly exciting when we start to study their healing properties. So what this study showed was that you can take individual cannabinoids from cannabis and see what they do to treat cancer, but actually when you combine them, the effect is greater than the sum of its parts. So these are actually working together in a synergistic manner to help fight cancer in our bodies and likely prevent cancer as well. The last thing I have to say about that, everybody asks me, you know, what about the smoke of marijuana? Doesn't it cause lung cancer? And the truth is, marijuana smoke contains carcinogens. One joint might have as much as 5 times the carcinogens as a single tobacco cigarette. Yet when we look at a large study of more than 1,000 people that are heavy marijuana smokers and 1,000 people that are non-smokers, and we control all the other variables like age and gender and smoking and drinking and all that kind of stuff, the people that smoke marijuana heavily actually have a reduced incidence of some respiratory tract cancers. And again, theoretically, that's because of some of these anti-cancer properties. Marijuana is incredibly relieving to people with multiple sclerosis. And I think of all the conditions that I see in my office, this is the one that I find the most drastic results with. I mean, literally, before and after even a very low dosage of cannabis, this person's in a wheelchair or this person's walking. Or this person's wearing an adult diaper and now using the bathroom with good bladder control. I mean, it's really black and white before and after cannabis. And I have some patients with multiple sclerosis that get these positive effects with as little as a couple puffs a week. I mean, it can really be a minimal dose that will do this for people. Not only does it treat the symptoms of multiple sclerosis, but it slows the it may slow the progression of the disease. And it's been shown to decrease the reliance on other MS drugs. Again, so it's protecting the nerves, that neuroprotective part. It's helping the symptoms, and then it's modulating the immune system to get it to stop attacking itself, to get our immune systems to stop attacking our own bodies. Next one. Crohn's disease is another inflammatory disorder, but this time instead of our immune system attacking nerves, it's attacking the tissue that surrounds our small and large intestine. Crohn's disease can be an incredibly debilitating condition like the other ones that I've mentioned today. It causes ulcers and fistulas, which are little pathways between different parts of the intestine or organs. It causes a lot of rectal bleeding and diarrhea. I mean, it has a very serious effect on people's lives. I've seen incredible results with using marijuana to treat Crohn's disease, and if you ever talk to anyone with Crohn's disease that's tried this, it's again one of these situations that's like night or day. It slows down the transit time, so the gastric emptying into the intestine, the small intestine emptying into the large, it slows that all down, so that all this kind of diarrhea and loose stools, and that really calms down the bloating, the cramping. It modulates the immune system again to affect the cause of this. So it's not just symptom treatment, but it can actually treat the cause of this condition and just vastly improve people's quality of life. So they're gaining weight, they're feeling better, they've got less pain, they've got less bleeding. It's really incredible what it can do for Crohn's disease. There's a similar condition called ulcerative colitis, which just affects the colon and not the small intestine. And that's not an indication in Maine right now. Some people that have ulcerative colitis also have chronic pain, that's abdominal pain, because of that condition. And so those people might qualify under a chronic pain diagnosis. But I just want to point out some of the idiosyncrasies of the current law, because these conditions that are approved in Maine weren't devised by doctors. They were written up by lawyers and politicians. No offense to lawyers and politicians. We just each have our own specialty field. Let's go to the next one. Okay, so this is a lot of what I was just talking about. Again, it helps with all these conditions, and Crohn's disease helps them gain weight and reduces the amount of other medications that they have to take. Next. Glaucoma is a condition where the fluid in the eye, for one reason or another, is unable to drain out of the eyeball, and that creates an increasing pressure in the eye. They call it increased intraocular pressure, and ultimately it can damage the optic nerve by compressing it in the back here. In a lot of situations, people with glaucoma don't even know they have it until they start to lose their vision. In other cases, people can actually feel the pressure in their eyes and know when it's up or down, and sometimes this is a painful condition. So this is probably one of the earliest conditions that was demonstrated in the media. You know, this person was going blind and they're using marijuana and now they're feeling better. And a lot of the mainstream ophthalmology opinion is that, and I don't know, this was in the research early on, that marijuana only reduced the pressure in the eye for 15 or 20 minutes and then it came up again. But what I've been seeing clinically is much more than that. I mean, I've seen 2 patients this week that have been using it for glaucoma, and they go into their eye doctor and don't say anything, and the doctor's like, wow, your pressures are so down, and it's been 3 or 4 hours, you know, since they smoked. It actually does seem to be a very useful medicine for this condition, and some of the other treatments are eye drops that can be burning or itching or irritating, but this doesn't cause any of that. It actually it reduces the pressure in the eye, which one side effect of that is that when the pressure is down, these small blood vessels in the eye and in the cornea can dilate, and that's where this red eye comes from. So that the eyeball pressure goes down. So one of the side effects of cannabis can be engorgement of the blood vessels in the eye. Hepatitis C is an interesting case. It's one of the indications in Maine. This is the hepatitis C virus. It's a viral infection of the liver. It's transmitted through body fluids. People have gotten this through transfusions or other, tattoos sometimes, other accidents, and, or different, dirty needles, things like that. Hepatitis C is a chronic condition that over a patient's life can eventually lead to liver failure, which is a very uncomfortable path for people to take. Marijuana has a dual role in hepatitis, and so even though this is an indication, we're very cautious with this. There's a few pieces of evidence that are important to know, and I'm bringing this up tonight because I know hepatitis is a pretty widespread condition. Marijuana does help with the symptoms, so this abdominal pain, this fullness, the kind of achiness, the fatigue, there's some mental symptoms that go along with hepatitis like depression. Marijuana certainly alleviates those. It's also been shown to help patients get through conventional therapy. Conventional hepatitis therapy is very difficult. It's a very long course, like 2 years, and it's IV therapy with these drugs that have severe, severe side effects. And a huge amount of those people actually drop out of conventional therapy before they finish. There was a good study that showed the people that use marijuana going into conventional therapy are more likely to finish the therapy and more likely to be successful. On the other hand, there is some evidence that THC can increase the rate of scarring in the liver in people with hepatitis. And so when we look a little bit closer at that, we find what we find in most areas of the body, that marijuana has dual roles. So the CB1 receptor in the liver, which is the cannabinoid receptor in the liver that was first discovered, when it's stimulated by THC, it actually increases the rate of scarring and fibrosis. There's the CB2 receptor in the liver that decreases scarring and fibrosis. And recently, a different cannabinoid than THC, something called cannabidiol, has been shown to decrease inflammation, decrease scarring and fibrosis in the liver. So it's never black and white. This field is still emerging, but we know that like a lot of conditions, marijuana can have a dual role in hepatitis. The types of marijuana that have been found on the underground market for the past 30 years sell better when they're more psychoactive. When they get you high or stoned, they have more market value. And because of that, over the years, breeders have been finding ways to get higher and higher levels of THC in the strains of cannabis. But what's happening now is a resurgence of, wow, this is really good medicine, and it doesn't really need to have very high THC in it in order to be effective. Actually, some of these low THC strains are great, and some of these strains that are high in other cannabinoids, like cannabidiol, could be really useful. So while one strain of marijuana might make hepatitis C worse, another one might make it quite a bit better. So this is a complex picture here.